we go now. Advocacy. Say no to vaping. Say
the World No Tobacco Day. The World No Tobacco Day is marked on 31st of May every year, and the theme of this edition is Unmasking the Appeal, Exposing the Industry Tactics of Tobacco and Nicotine. The theme reminds us that the fight against tobacco is far been over. It is not just a fight against a dangerous product, but against an industry that have continuously been invented its method to profit from addiction, suffering, and misinformation, especially targeting our youth. The emergence of vaping, e-cigarette, and other new tobacco products in recent years has introduced fresh challenges among the youth. The global epidemiology of tobacco use reveals that 22.3% of the world population were tobacco users, with an high percentage in men, 36.7%, using tobacco compared to female 7.8%. Users reside in low-income countries, including our dear country, Nigeria. An estimate of 37 million young people aged 13 to 15 worldwide use tobacco. The Global Tobacco Survey report for Nigeria shows that 4.5 million, that is 5.6% of adults aged 15 years and above, currently smoke. 10% male and 1.1% women, while 6.6 million of the adults were exposed to second-hand smoke during visits to public places. In Nigeria, the prevalence of smoking among youth varies. Studies show that it ranges from 3.4 to 17.1%. The factor influencing youth smoking include peer influence, friends of smokers in the family, the ability to purchase cigarettes near school or other accessory locations, and exposure to second-hand smoking and use of tobacco. For generations, the tobacco industry around the world, including Nigeria, have thrived or profited on deployment of well-calculated tactics. They have masked the arch reality of addiction and disease beyond attractive, advertisement, targeted marketing, flavored products, and endorsement by, celebrity. Every day, tobacco and nicotine industry use carefully engineered products and deceptive tactics to hook new generation of users and keep the existing one. There is no medical benefit in tobacco consumption. It causes long-age diseases such as cancer, cardiovascular diseases, and chronic respiratory disease. That is why we must act together to protect our health, our children, our youth, and our community from these adverse consequences of the dangerous products. We must do everything possible to make Nigeria a smoke-free country by adopting policy that creates smoke-free environment. A smoke-free environment is not just affirming the right to life. It's about protecting the vulnerable, reduce the burden of disease, improving productivity, and securing that the future generation inherits a healthier and a more lively society, promote differentiation of public places, protect non-smokers from second-hand smoke, increase tobacco taxes, and provide support for those seeking to quit. The Nigerian Tobacco Control Act in 2015 was a milestone for public health policy, aligning the country with the WHO Framework Convention on Tobacco Control. However, implementation have been inconsistent and underfunded. Although Nigeria has recorded some results, such as ban on tobacco advertisement, warning labels, and smoke-free zone, enforcement remain weak, especially at sub-national level. Public smoking persists, and tobacco products are easily accessible to minors. The key gaps include inadequate monitoring, low public awareness of law, lack of institutional synergy, and poor accountability of the tobacco industry. To unmask the tobacco industry tactics, we must educate the public, especially the youth, on the manipulative marketing and product placement strategy and e-cigarettes, enforce stricter ban on advertisement and promotion, especially on social media, launch fact-based campaign that debunk myths about safer alternatives like vapers, engage influencers, health professionals, and youth leaders in advocacy, strengthen school-based programs that build media literacy and resistance skills in youth, enforcing mandatory transparency from tobacco companies on marketing, budget, and earth claim. The Nigerian Cancer Society, over several decades, have been involved in campaign against the use of tobacco in the country, with some results achieved. However, increasing number of young population are now vulnerable and actively smoking cigarettes and other narcotic drugs. Further, the tobacco company are now targeting the youth, and increasing number of them, are being captured. The Nigerian Cancer Society have changed a tactic against cigarettes, tobacco use, which is one of the major risks for many cancers, by encouraging the youth who are members of the Nigerian Cancer Society to be actively involved in this in addition and going forward.
The data we are getting, in fact, the other day leading to the launch of the Yo Health, we're having conversation with the Nigerian Economic Summit Group. And one of the things they said is that when they looked at the data, they are seeing now a rising case of respiratory diseases and some cancers and young people that were not there. And some of these things are attributable to some of these things that young people are smoking. So the Honorable Minister of Youth Development, Comrade Ayodele Olawande, is committed to this smoke-free future campaign. He wants to see a future where young people are protected from all the hazards that come from smoking. As the president of the Nigerian Cancer Society has asked and requested, he would join in leading the campaign so that there would be an increased tax for tobacco, shisha, and all the kind of cigarettes. And that money saved can now be reinvented, can be put into things like health insurance, especially for the informal sector. Our youth in the informal sector needs to be covered, and we need to rather take money from things that are harmful to them, like cigarettes, shisha, and vapes, and then put that in taking care of ensuring universal health coverage for the youth population.